why are you feeling dizzy or like the sense of vertigo? This is pretty complex. So why are you having vestibular dysfunction? So here are some common causes. It's probably not all of them. There's a lot of things happening at play that are interrelated. And this is some that hopefully you will find useful. So the first thing you have to look at is maybe it's an inner ear condition, such as vestibular neuritis, which is where you want to go see your physician, right? Talk to your physician first. The other thing that you might be having in your inner ear is BPPV. It's quite common. It's when your crystals get out of alignment. This could be from a fall, trauma. Sometimes we don't know. It's just you rolled out of bed and here we are. But your physical therapist or physiotherapist are going to be really great allies in resolving that. Another common cause for vestibular dysfunction symptoms is head, neck, and jaw injuries or, happenings. And so this is what I've seen the most in my practice. And so we're talking like concussion, whiplash, TMJ dysfunction. And so that can interfere with the nerve firing to the brain. You can get a swishing or pain, and it's going to disrupt the messaging. We also see age as a potential cause. As we age, we're not as efficient at firing and reading the messages within our body. That can cause a little bit of disorientation and imbalance, dizziness. Another common cause I've seen in practice is stress. So chronic, long-lasting stress. And I've seen this the most in my clientele that are in menopause. Looking at lifestyle is important. If it's not adding up, but you've had a lot of stress and maybe some anxiety, this could be part of it. And, resolving your lifestyle is going to really help take down the sympathetic from firing and then alleviate some of that pressure in your jaw and your cervical spine and your neck. And finally, what we see sometimes is structural or mechanical issues. And so cervical or cranial bone restrictions. So, your cranial bones actually do move a little bit, not a ton. And your cervical spine is definitely supposed to move. And when there's a restriction, of course, it's going to inhibit the capacity of the nerve to fire a message back to the brain, which gives you this sense of dizziness, imbalance, and disorientation. So I hope you find this useful. If you have any comments or questions, please leave them down below. We asked you what you wanted to hear about next, and so we're talking about vestibular dysfunction. So we're doing a 3-part series in our blog, but also we're gonna be putting lots of information here. Next week, I'll be going into a little more of the home care that you can do at home to help resolve your vestibular dysfunction or get control over it.